Yep, and I'll watch that.
Okay.
We're going to go live here.
Well, let me know when.
I'll talk first and I'll introduce you.
Okay.
It's in 5 seconds. You're welcome. Good morning, everybody. Thank you so much for joining us today for one of our carrier connections. I hope you've been following along all month. We've had a lot of our carrier partners join us, probably about 3 times a week. We've been doing them. If you missed any of them, you can go onto our calendar on our URL website and watch them. They're all being recorded. This is the last one for the month since we only have one more day in March. And then starting in April, we're going to be doing our agency building webinars. So join us for those. You can register also on our calendar on our website. If you haven't seen this webinar platform before, you want to go ahead and click on the blue chat box on the bottom right of your screen, and that will open up the area for chat, Q&A. We don't have any polls or handouts today, but those are there as well. The chat is public, so just be aware of that. And if you do have a question, you can type it in either chat or Q&A, and we will get to those as they are relevant. Today we have UPMC joining us, and we have Lou Johnson here. So you take it away, Lou.
Okay. Well, good morning, everybody, and thanks for attending. I'll try to keep this as interesting as possible because it's just basically you're going to be looking at a slide, and I'll be reading it. I'm not going to read verbatim, kind of going to hit the high points. We're covering one of our products today called Complete Care, and this is for the central region and western PA regions. There are 2 other regions, and the plans are similar, but there are a little bit of differences. So we'll just get started here. Okay, the agenda today, we're going to give you an overview, the eligibility, some of the benefits of the plan, some of the extra benefits, and the health risk assessment that we'll be referring to as the HRA, and then again, community health choices. Okay, what is a special need plan? It's a type of Medicare Advantage plan. This one happens to be an HMO. The membership is limited. It's to specific people with specific diseases or characteristics. The benefits are tailored to them, provider choices, the drug formularies, to best meet the specific needs of the group that they serve. Now, who's eligible to enroll? Okay, the guidelines for this are established by CMS, institutionalized Medicare beneficiaries, individuals with severe or debilitating chronic conditions, and dual eligible beneficiaries. The enrollment requirement: an individual can join UPMC for Life Complete Care if they are entitled to Part A enrolled in Part B. And then, of course, you must live in the service area, same as a regular MAPD plan. Okay, here's a map of Pennsylvania broken down by counties. We're covering the plan in the dark purple, and then you have northeastern Pennsylvania in real light purple. And then you have the Philly area, the 5 counties around there. It's kind of, I don't know, I guess a pastel and Easter purple. I don't know. There are 2 counties in the state that we don't do business in, Northumberland and Columbia County. Okay, special need plan, this is your member ID cards. Okay, if you just have the special need plan, you'd have the card on the left. If they have their community health choices also with us, and they take our complete care plan, they get 1 card for everything. That kind of streamlines the process for them. They don't have to take 2 cards with them. They can just take the 1 UPMC card. To join our plan, you must be a citizen or lawfully in the United States, and again, enrolled in Parts A and B of Medicare. And you have to be enrolled in the medical assistance or the Medicaid program, and you must be receiving full medical assistant benefits. It's where the term dual eligible comes in. and of course, permanently live in the planned service area. Okay, eligibility again is determined by the DHS, also referred to as Medicaid or MA or Access, Health Choices, Community Health Choices. A lot of different names that mean the same thing. You must meet income resources in some case and other eligibility requirements in order to qualify for medical assistance. And then there's a website you can go to see if you qualify. Types of medical assistance: there's full medical assistance, often covers Part B cost and copay and coinsurance. Partial medical assistance with premium assistance often covers Part B costs. They are not eligible for the complete care. Other types of state assistance include the SNAP/food stamps or cash assistance, LIHEAP, or help on their housing. Okay, the special need plan timeline to enroll. Beneficiaries with Medicare and medical assistance or Medicaid will only be able to make one Medicare plan change per calendar year per quarter during the first 9 months. That means they can make one plan change during each of the time frame below: January to March, April to June, and then July to September. And then, of course, you go into the AEP. Okay, their coverage will be effective the first of the next month. Some exceptions to when certain events happen in their life. If they lose medical assistance coverage, these rules about when they can make changes and the types of changes they can make based on their circumstance. The SEP is considered used based on the month in which the individual makes the election, the application date. If the plan receives an election in March, it would be effective April 1st. This counts as using their election in the first quarter, not the second. So it's the quarter that the application is taken. Okay, and then again, the enrollment period, the pre-enrollment period, they're locked in their plan from October 1st to the 14th. And the Medicare election period, the AEP, takes place October 15th through December 7th. During the AEP, they can add or drop Part D prescription coverage, change to a Medicare Advantage plan, or to original Medicare with an effective date of January 1st. And then from December 8th to the 31st, they will be locked into their current plan. Okay, what happens if a UPMC for life complete care members loses full medical assistance? Department DHS, they notify us. The member will have a grace period up to 6 months, 180 days to remain on UPMC for life complete care. Notice will be sent to them during this time. They should apply to see if they can get their full medical assistance back, and gives them time to research plan options if they no longer qualify. Beneficiaries have the option to join a Medicare Advantage plan. So if you would have any clients in this situation, it's good that they take, the 6 months to make the choice, just in case they would get medical assistance back. Okay, if they do regain that, they'll stay right on the plan within that time frame. If they don't, they'll be disenrolled from the plan and placed on original Medicare. At that time, you can put them in whatever is best suited for them. Now, some of the plan benefits: zero premium, medical services are zero copay, prescription perks, zero copay for all covered prescriptions through any phase. A Shop Healthy card, they get $400 per quarter. It does not roll over. They must use that. That's $1,600 per year for over-the-counter products and healthy food for all members. And dental, in this area, they get $7,250 of dental services. And like I said, the other plans, Northeast around Philly, it's $4,000. They get $575 allowance per year for contacts or eyeglasses. And then this area here, it's $5,000 for hearing aids every 3 years. That's both ears. And again, it drops to $3,000 for the other areas. And they pay zero copay for up to 6 home safety products per year. And as you can see, the dark purple box on the right, that there, it gives you the bullet points that I just went through. Again, you can see the service area at the top. A lot of the counties, that's the one that this particular plan, West and Central. Again, you look at 22 to 23, they increased the MOOP. Okay. Of course, as you know, normally that isn't paid by the beneficiary at all. The 0 copays for all drugs now. The hearing aids went up to $5,000. The OTC grocery allowance card went up to $400 a quarter. Okay, now it's combined. Instead of last year was $350 and $25. And they get 61-way trips for transportation. Again, they get to 6 home safety products. The SMP, the MOOP change. It's been increased for all SNP plans. It's due to changes that the government has made on how SNP benefits are paid. MOOP for dual eligible beneficiaries is now calculated based on the Medicare Advantage plan's total cost sharing for the SNP plan. Cost share paid by members, any cost share paid by secondary or supplemental insurance, like the Medicaid, CHC, group, employer group health plan, commercial health insurance. Any remaining unpaid costs due to limits on Medicaid responsibility for the Medicare cost sharing and protection given to dual eligible beneficiaries. I guess to sum that up, if they have to pay anything at all, a few dollars here or a few dollars here, which is very unusual. I've been doing this for a long time and I've never seen that happen, but that would be because Medicaid is paid, their limit is what they would pay. Okay, the MOOP's now $8,300. SNP members still have 0 copays for most covered medical services. This change will be communicated to SNP members in September with the ANOC mailing. Annual notice of change. Most SNP members will be unaffected by this change and will not hit the MOOP due to the low cost sharing in their plan. Okay, the OTC grocery VBID card, UPMC for Life, Healthy Shop, our Shop Healthy card. The program helps members get over-the-counter products and healthy food. We'll be promoting this program for all SNP members and AEP retention materials starting in September with the ANOC on 10/1 with the value brochure mailing. What is it? It's $400 quarterly allowance for OTC products and healthy food, $1,600 a year. This allowance does not roll from quarter to quarter, so they have to use the $400 per quarter. They're automatically participating in it. All SNP members receive this benefit starting January 1, and it will be mailed UPMC Complete Care Health Shop Healthy card and instructions on how to use it. The next slide we'll talk more about the VBID. And that's what the healthy Shop Healthy card looks like. Okay, they'll no longer have a separate allowance for over-the-counter. They'll now use their card to buy over-the-counter and groceries. They can purchase at participating retail stores. They can also purchase covered OTC products through the mail order catalog. Groceries aren't available through the mail order catalog. Some participating, but not all. Giant Eagle, Rite Aid, Walmart, Walgreens, just to name a few. A full list can be found on the UPMC Health Plan public website, and that's the website there. Mail order OTC products are now purchased through our new vendor, Convey. Healthy food groceries cannot be ordered through mail order. Convey has several ways of ordering products on their website, which is there. Through hard copy catalog, members can call the healthcare concierge team to have a catalog mailed to them. Catalogs are sent through the Converge fulfillment website by calling Convey. The 800 numbers there, and their hours are from 8 till 11. Covered retail products in the mail order catalog can be found, and the website is there. and then the 800 number. You can look up your card balance by the 800 number, logging onto your My Health Online secure member portal, downloading the WEX app. Okay, Part D, VBID for Life Complete Care Prescription Perks. We'll be promoting this program for all SNP members in AEP retention material starting in September with the ANOC and on 10/1 with the value brochure mailing. What is it? Zero copay for all covered formulary prescriptions at participating pharmacy through all phases of the Part D, the initial coverage gap and catastrophic coverage. Automatic participation applies to all level of extra help. What should member do in filling prescription? They should use a participating pharmacy with a covered prescription. When they show their UPMC for Life Complete Care membership ID card, they will automatically receive the zero copay. And then again, the dark box is a bullet point. Okay, the VBID, value-based insurance design. It's to basically, it's to make the plans more affordable and more specialized for this particular segment that qualifies for the complete care. Okay, pharmacy coverage, again, the 5 tiers, which have been around forever. I'm sure it's not new to anybody that's even sold for a year. Part D prescriptions are dispensed at a 30-day supply, except for long-term care facilities. Temporary transition, again, they get to 30 days for non-formulary drugs. If they switch and a drug's not on, they get it refilled once till they can find an alternative. And long-term care, it's 31 days. UPMC for Life Complete Care have preferred and standard pharmacy. The costs will be the same because all members now have zero copay for covered prescriptions. And some of the extra benefits. Healthcare concierge. Okay, they won the Stevie Award. Okay, our award-winning team dedicated to providing you with answers, personal support, very best customer service experience. 2 years in a row, they've won the Stevie Award for overall sales and customer service at the 16th Annual Stevie Award 2022. Resources for Life can help you solve life's problems, big or small. You can get legal counseling, financial counseling, personal caregiver support. Can even recommend services such as pet sitting, volunteering, handy person, transportation, health, wellness activities, and much more. And Silver Sneakers, it's been around for a while. There are some extra perks to that. It's they give reimbursement to certain colleges if you're a regular participator in Silver Sneakers. I think you have to go at least 7 times during the month. If you want more information on that, you can shoot me an email and I can get you the exact figures on that. And then the RX Well app for free. It addresses anxiety, stress, depression, weight management, healthy eating, physical activities, and help for quitting tobacco use. You receive a personalized plan, set up goals, work with a live health coach to get help along the way. And members can download the app from their device app store. UPMC Anywhere Care. Okay, convenient care. Convenient access to care for common medical conditions through an online virtual visit. You can also meet with a licensed pharmacist to ask questions or get information about your prescription drug. Again, zero copay for UPMC Anywhere Care. Then there's a 24/7 nurse line. Give you support or help over the phone for a large range of health issues at no cost. There's the 800 number if you wanted to, speak with a nurse. And they could help determine if you need to be treated for your illness or injury. Assist America. Get help 24/7 when you travel more than 100 miles away from home or to another country. This program connects you to doctors, hospital, pharmacy, and other services all over the world, so you're never without access to care. And it's included with your membership at no additional cost. And again, the home safety products up to 6, some examples: raised toilet seat, shower chair, transfer tub bench, handheld shower, non-slip mat, plug-in light, clamp on the tub rail. You can get a home safety visit. You get 1 free in-home safety assessment a year with a licensed healthcare professional. They can give you tips and advice to help you live independently and feel safer at home. And then we have tools for caregivers to help them reduce their feeling of loss, loneliness, stress at no cost, get resources to communicate effectively, make tough decisions, set goals, and solve problems. Coverage for your whole health. You get health coaches. They'll help you customize a plan, lose weight, become more active, better manage a health condition like diabetes, asthma, or high blood pressure. A personal care manager's trained professional to help you understand your doctor's instructions after a visit, outline your next steps after your diagnosis, even help you coordinate your future care. And personal counseling. You can receive 6 sessions per concern per year with a trained licensed counselor at no cost to you. And then coverage at your fingertips, your online health, secure member website, your one-stop for all your healthcare tools. You can view your plan's benefit, chat with a healthcare concierge or health coach, pay your monthly premium bill, view claims, and much more. UPMC Health Plan mobile app, free app, allows you to search for providers, live chat with the healthcare concierge, access your member ID card, view claims, pay your monthly bill, call your doctor, pharmacist, or call the UPMC My Health 24/7 nurse line. And then the health risk assessment, the HRA. Follow these steps to be eligible for the additional $75 per payment or per enrollment. Okay, when your Medicare SNP eligible client completes the enrollment application, make sure you have the client complete the HRA survey with you in person, telephonically, or during a virtual visit. The document prints as a 3 one-sided sheets of paper, makes it easier for you to fax or mail back in. I believe that is a change. It's now 5 sheets. Clearly write your client's first and last name, your first and last name, and your writing number at the top of the survey. Make sure all questions are completed on the survey, and then answer bubbles are completely filled in. If you also have hard copies of your client's scope enrollment application, you must include the HR survey with these to be eligible for the $75 payment. If your client telephonically or electronically completed the scope or enrollment form, you must send the completed HRA survey within 48 hours of enrollment. And you can submit these items through any of the methods you typically use. Send new member information, fax, email, mail, scan, or upload in Cavulus. I'll add a point here. If you do, if you're sending the HRA form separately, make sure you put a note in Cavulus that you have sent the form separately from the enrollment if it's electronically or by telephone. Okay, you'll be eligible for the $75 payment for each correctly completed HRA survey received. HRA payments will be processed separately from regular commission process, and they will be paid by the 30th of each month. HRA surveys cannot be collected at any sales event. Now, community health choices. Okay, there's shows 4 there. I believe there's AmeriHealth and Keystone are kind of one company now. Different areas of the state, they're called different. PA Health and Wellness, and of course UPMC for Life. Okay, the managed care organizations that won the contract this time for the CHC. Individuals are eligible for CHC if they're 21 years or older and are dual eligible Medicare or Medicaid, Medicare and Medicaid, or eligible for Medicaid only, no Medicare, and qualify for long-term service and support. Most CHC enrollees do not qualify for LTSS. To qualify for LTSS, you must be assessed to need a nursing facility level of care, known as nursing care clinically eligible. Individuals who are dually eligible may qualify for LTSS, but are not required in order to be eligible for CHC. CHC is a Medicare product. Covered physician services equal to the Medicaid adult benefit package. Secondary Medicaid payer to primary Medicare coverage for dual eligible individuals with or without LTSS. Primary Medicaid payer for individuals with Medicaid only, no Medicare, and LTSS. Covers long-term care and support for those who qualify equal in Pennsylvania and in the House bill there. Ongoing support for custodial nursing home resident or home and community-based services. CHC versus access card. How's it different? Medicaid benefits for medical services that used to be covered by access are now covered by CHC MCO that the recipient chooses. When receiving medical services, CHC participant, they should show their ID card issued by the CHC MCO and their Medicare card if applicable. If a CHC participant misplaces their CHC card, they can show their access card. CHC participants must keep their access card for other services they may qualify for, such as food stamps, SNAP, or medical assistant transportation. Below are examples of the combined UPMC Community Healthcare Choice Card for Life, Complete Care Access Card, and other access cards. So there's the card on the left, UPMC with the Complete Care, and then on the right, other examples of the access cards for Pennsylvania. How's CHC different from Medicare? It's a Medicaid plan. Does not affect or change your Medicare coverage if they're already receiving Medicare services. Medicare's primary, covers most of their health care services, including prescription drugs. CHC is secondary Medicaid coverage through one of the CHC MCO plans. Medicare Medicaid benefit may be eligible for both CHC and dual SNP plans. The plan works together. They do not compete. Beneficiaries do not have to fear losing CHC if they enroll in a dual SNP plan. Okay, choosing to enroll in UPMC for life complete care or not choosing to does not affect the coverage individual for CHC. No matter what type of Medicare coverage the individual have, CHC benefits remain the same. Now, to apply, they're notified by the Department of Human Services. If they're eligible, they must select a provider for CHC or the Living Independent for Elderly, the LIFE program, if applicable. If they don't make a selection, CHC MCO will automatically be assigned. But you can change that by your plan at any time by the PA Independent Enrollment Broker. There's the phone number, the website, or you can do it by mail. CHC is not commissionable or available for agent sales. You should never try to influence an individual to change CHC or to remain enrolled in UPMC CHC if they want to choose a different CHC. This includes never stating or insinuating that UPMC is better than other CHC plans or that by enrolling in UPMC, they would get more better CHC benefits. If an individual has question about CHC enrollment or benefits, refer them to their current CHC MCO or to the IEB. In-network providers. When dual eligible individuals receive Medicare coverage services, their providers, they don't have to be in the CHC network. Providers must be in the member's Medicare network. It's very important to verify that an individual's providers are in the UPMC SNP network. Even if the provider is not in the CHC network, they can bill CHC secondary. Now, the exception, if a service is being covered primary by CHC because it is covered by CHC, but not Medicare benefits, or Medicare benefit limit has been maxed, the provider doesn't need to be in the Medicare network, but does have to be in the CHC network if they plan to bill for services. Okay, CHC and UPMC for life complete care. Why should someone with CHC consider UPMC life complete care? Again, the dental amount, the eyewear amount, the hearing aid amount, silver sneakers, bathroom safety product, and the healthy shopping cart. In addition, if they have UPMC Community Health Choices as their CHC, it's one card, one-stop shop for member, one phone call for clients' questions regarding their coverage. If you're speaking to an individual who's enrolled in CHC plan that is not UPMC CHC, you cannot discuss the benefits of having both UPMC SNP and UPMC CHC. You should not encourage them to enroll in UPMC CHC. You can only discuss UPMC SNP benefits. Plan benefits. The SNP plan provides all the usual services covered by original Medicare and some additional enhanced benefits. Members must use their network of doctors, specialists, hospital to receive covered care services. If a member has UPMC CHC and UPMC Complete Care, they will receive only one ID card from UPMC, and it will contain two member ID numbers. First number is the SNP number, and it's primary. Second ID is a CHC Medicaid number and is secondary. UPMC for Life Complete Care members that are not enrolled in UPMC CHC must also show their CHC card issued by CHC MCO along with their UPMC for Life Complete Care card. These members will only receive a UPMC for Life card from UPMC. Their CHC MCO will provide them with their CHC Medicaid card. Again, the little box on the right there, the bullet point. Now, the DSNP population, develop relationships with persons of influence, social directors, the building site managers, clergies, program managers, caregivers, family members. Locations to target for this population: low-income housing, senior high-rise, senior centers, food pantries, farmer markets, produce for people, produce vouchers, soup kitchen, health fair providers. And you have question, contact your broker or manager. And that's it. Any questions?
I don't see that we have any, Lou.
All righty. Well, thanks for your time and thanks for attending.
Yes, thank you. And I can't wait to see your tree with the next season.
All righty.
Have a good day.
You too. Thank you.